Doctor, now we have a few questions from our European parts of world. Yeah. Now we in a territory of European culture and European medical culture, and the tradition of European medicine now meeting with Tibetan medicine tradition, and for sure we feel any influence of each other, and we heard what MG, Tibetan MG, start to see laboratory test and study anatomy and so on. What do you think about them? Is it useful for Tibetan medicine?
Yeah, of course, yeah. So yeah, that's very useful, because we say that Tibetan medicine is kind of a science. So we used to translate saying that it's science of healing. So in a sense that we consider that this is also one a kind of science. So in a sense that Tibetan medicine is considered to be a very authentic medical system, which is very useful for for so many people in a real sense. It's not like talking about the magical powers and all these things. So we are talking more on the evidence-based kind of treatment. And also in our clinic, for example, in my clinic, time to time I'm seeing so many patients who are non-Buddhist, so there's nothing to do with our own, the culture connection. So people are coming from so many different backgrounds. Like there were so many people who are coming, who are believing in so many different cultures. Like some people in Hindu cultures, Muslim communities, and all walks of life. So in that case, these patients, they are coming to the clinic not to see that from those backgrounds. They are coming there to get the treatment that they heard from the others, that it was it somehow helped them in a sense that this medicine is useful for example, like a patient who is having a very chronic gastritis. So they have undergone all kind of treatment, and somehow it doesn't work. So they used to come to our clinic, for example, to get the treatment. So in that particular case, they are coming to solve the problem. So in that case,
and for them, doesn't matter which kind of system will be used.
Yes. Even vast majority of the patients, they don't really know what is this system actually. They don't know whether it's Tibetan medicine, or they think that they knew that this is a herbal treatment, but they don't have any ideas. So in that case, my idea is that it should. So we are saying that this is more like evidence based. And also modern science is very important, because for particularly in my opinion, I think the science is nothing but it's just our language. It's like a universal language. So for example, in Tibetan medicine, we have our own approach of analyzing the disease. So like we'd say lung, tiba, pekin. So if only I stuck with that, then when I see the patients, and then the patients will ask, okay, doctor, what did you find? So if I say, oh, this is your lung problem, people don't have any clue what is lung. Again, I have to explain. So if I say that, oh, your problem is more like gastritis, so if I try to integrate the terminology, so it at least could able to connect with the patients. So as a physician, especially in the art of treatment, the connecting with your own patient is
more easy to connect with the patients.
And also it's also very important, because to get the trust from your patients. So through this, the language of science, we could able to connect with the patients, and we could able to, analyze the problem in a more fundamental way. So that's why even in our college, so we have already started integrating that, the modern medicine. Because
which parts of European medicine are you studying? Anatomy or laboratory analysis? Or what?
So in our college, the college is basically for bachelor level program, which is affiliated with the university. So this is for 4.5 years. So mainly in the college, we are teaching to our students mainly the Tibetan medicine, particularly the 4 treaty or 4 tantra. But somehow, like 70% of the teaching is more Tibetan medicine, but 30% or more than 30% is the modern medicine. So when there was like in every semester, so this was classified into 9 semesters. So every semester every semester they have 5 different subjects. The students have to take 5 different subjects. So for example, like when they were studying the Sowa Rigpa anatomy, there is another subject that is called the modern anatomy.
Parallel.
Yeah, parallel. So this is part of the curriculum.
What more? Anatomy?
Then anatomy. Then when our students are studying about the pathology, then also they have been taught about the modern pathology, how to read the ultrasound.
Pathomorphology, you mean? How looks, for example, body in an eel?
Yeah. How to do the blood, mainly the examination reading, like how to read the blood count, blood report, then then CBC, then the ultrasound, then all these different X-rays. So I think these things were very important, especially in the so now it's the globalization. Everything is now one problem of one country is problem of another country. So this is more like globalization.
I understand you.
So because of that, even when we are seeing the patients, we feel that we have been seeing so many patients when they, for example, in my clinic, when the patients they came with a huge medical report, and then they put that in the table, and then they say, "Okay, doctor, this is my problem. So I need to understand this. I can't say I'm not going to look." They said, "This is my problem. Can you look at this and can you help for me?" So I need to go through that. I need to analyze this, understand this. Then I need to check pulse or urine. Then integration, I need to explain the patients.
Okay.
So this is how we go.
Yeah. Thank you. Very open answer. Okay. And my second question now, not necessary to ask you because you already answered for it. Yeah, it's about analysis, and I'm just with a relationship with a follower of traditional approach. Few MG tell about what if you include European method, it's like a violence of tradition. It's a violence because it's tradition with the blessing of Yutokpa, with the blessing of medicine Buddha. If you go do the step out, it's like a violence. Is it true? What do you mean? Is it a spiritual tradition? If you include something other, it's violence.
Yeah, so for that, I think we should look from a 2 angles. The first, as I said in the beginning, so especially from the lens of the Sowa Rigpa or from the lens of Tibetan medicine, so we look from more holistic perspective of the life. So when you talk about the health, we don't really talk about only the somatic problems. So we talk about the holistic, the physical and mental problems. So in that regard, as far as the physical level is concerned, it is important that we should always incorporate with the modern science, because modern science is the best tool to analyze the disease and also to have the better communication with your own patients.
Okay.
But on the other hand, also there are some spiritual part also. So especially when you're talking about the psychological problems, so there are certain things that may not be understand by the modern medicine at this moment, especially like the psychological problems. Like some people, so we talk about the mind and the physical body in a separate entity. Of course, is connected. So in that level, there is another realm. So one should be very kind of we should go in a parallel way to understand. So that's why modern medicine is very important, because these days everybody talks about the evidence base. So and also it's easy to judge the people also, and also in the this is considered to be a degenerated age. So there are so many different types of people, and not all people are good. Not all people are going in the wrong direction. There are so many funny people also, so who claim themselves as something magical and things like that. So for that we need certain kind of regulations to see what are the parameters, how this can go. So in short, to use the modern medicine is the best tool to control all these things.
Nice to hear it. Yeah. I have not questioned before, but you touched this topic. It's a spontaneous question, will be. In European medicine, there is a part psychotherapy. I think it's very useful for people because so many mental diseases, mental difficulties. But in Tibetan medical tradition, it's totally not gross. What you can advise for people which living on your territory? Do we have a psychotherapist in Kathmandu? Are you included in your treatment? Me, yes, because I think it's easier. Sometimes give advice for patients go to psychotherapist than waiting how Tibetan medicine give action. Yeah, what do you do in this situation?
Yeah, so this is also
not all people can meditate and regulate myself, so we need help on the mental level. What do you think?
Yeah, so this is a good question. So basically in Tibetan medicine, this is actually the part of Tibetan medicine, to deal about the mental problems as psychotherapist.
But by another way in Tibetan medicine.
So in Tibetan medicine, so when you look at the history of Tibetan medicine, so when you look at the history, you can find that the Tibetan medical practitioners are all, like the practitioners by themselves. Like Yutok Yundan Gombo,
Buddhist practitioners.
Yeah,
meditative practitioners.
They are all meditative practitioners by themselves. So, like all these, So in a sense so we are practicing. So now the Tibetan medicine came to the lay people like us much later, only in the early of the 20th century. So before the Tibetan medicine is practiced by all these practitioners, great yogis, practitioners. So they are great meditators. Like for example, you can see the Tibetan lamas. So they were, the main task of the Tibetan lama is that they were more like a psychotherapist, So so they give the teachings, and then when people have the mental problems, then they used to give the techniques how to do. So similarly, in olden times, Tibetan medical practitioners, their role is also kind of the same thing, because when they have the patients, if they have the physical illnesses like chronic gastritis, rheumatoid arthritis, they give the medicine. They teach about how the diet, how to eat, then the lifestyle. Then, psychologically, then they teach how to do the meditation. And also they,
psychotherapy by Buddha Dharma teachings.
Yeah, mainly from so Buddha Dharma, in the sense that we should also classify that the Buddhist cultures into 3 categories. So His Holiness Dalai Lama often says that Buddhism itself is not Dharma, because there are 3 phases of Buddhism. One is aspect of the Buddhism is the Buddha Dharma, which is more like practice. The second part of the Buddhism is more like a Buddhist psychology. So it talks about how the mind. It talks about so many different classifications of the mind. In Sutra, Tantra, especially in Sutra, it says that the mind and mental factors. It says that there's one of the mind which is clear like crystal, and then it has 51 different types of mentals. 51 different types of mentals are nothing but all our emotions. Then it talks about so many classes in detail. So that's why often His Holiness Dalai Lama, he says that as far as the psychology is concerned, the Buddhism is very advanced. The modern psychology is just like kindergarten. Likewise,
I heard it.
Yeah. Then the third aspect of Buddhism is Buddhist philosophy, where it talks about it's totally like physics. Like it talks about the concept of interdependence, everything's interconnected, and then it's in subject and object, matter and energy, So it talks. So even the like these quantum physicists, they say that in subatomic level there is no independent entity which inherently exists by its own. So which was a long time it was said by in the Buddha's teaching and the Nagarjuna's concept of mathematical philosophy. It was core teaching of that.
Okay, yes, thank you. Nice to hear it.
Yes.
And maybe our last question. I heard what if MG, Tibetan doctor, are Buddhist and do meditation, his medical praxis, curing possibilities, become bigger, like grows, and doctor can help more if he meditate. Is it true?
Yeah, definitely.
Why?
Yeah, because
Why?
Because as I said, that Tibetan medicine is the core teaching of the Tibetan medicine is actually the Buddha's teaching. So that's why we say that when we talk about the disease, we say the three basic energies, Long, Tiba, Pekin, So when you look at the cause of these diseases, we talk about the three mental poisons, attachment, anger, illusion. Then the root cause of the disease is when we say marikpa, ignorance. So that is, ignorance is the main, the kind of enemy or the things that the Buddhist is, the practice is stealing. So in that case, as far as the root of disease is concerned, so this is connected. Then as a normal practitioner, like when we talk about the Tibetan medical text, so the 4 treaty or 4 tantra is the main text, but this is a more for grosser level of the human body. So Gyushi basically talk about the grosser level of the human body. The more subtle level of the human body, especially the Vajra body, is taught in the Yudo Nyingdik practice. So the Yudo Gyönden Gompo, who is considered the father of Tibetan medicine. So when he give the teaching of the Tibetan medicine, he give it in the two way, more grosser level and more subtle level. So the subtle level is more in the Yudo Nyingdik teaching. So that's why the practice is very important. It's part and parcel of Tibetan medicine.
How the state of physician influence for state of patients. Is there any contact? I can feel it. I can feel it. But I don't know how it's happened.
Yeah, so this is very important because in all walks of life, as a Sowa Rigpa, as a Tibetan medicine practitioner in the clinic, or to who's making medicine. So in whichever activity you are indulging, so where especially we have a separate topic for ethic of physician in Explanatory Tantra, chapter 31. We talk about ethic of physician. Ethic of the physician. How the physician should be, like a quality of the physician. So where it says that the main quality of the physician is compassion, compassionate mind. So this is important. So compassion is considered the main, like the fundamental, the quality of.
It's like it became parts of curing. Parts of curing.
Yeah. So if you have a compassion, then the whole phenomena will change. So that's why
it's a good answer.
Yeah. So in a sense that as Amchi or as a practitioner, you should have a very compassionate mind. So this really matters because even like it often happens, like some patients they visit different Amchis, like Amchi A and B, but the Amchi A is not that compassionate. The motivation is not that good. But B is very compassionate. He's bringing up the practice meditation. Then even they give the same medicine, but somehow this first one doesn't work. Second one it works.
So that's why to hear it. My Lama, he's not magician, but he tell the same. I can see what in this case curing. Act exactly compassion.
So that
process of curing is a process of action of compassion. Totally the same.
So human life is very complex. It's not like 1 + 1 = 2. It's not simple as
only me and pain.
So it's very complex. So it we can terms in terms of the matter, energy, especially energetic level. So we need all these component. So that's why many of the modern medical practitioners, they have big question. They say that I've often heard that they said that so for example they have 5 patients of diabetes. So when they give the same, so according to the analysis, blood report and analysis, all they have the same problem. But when they give the same medicine, first patients is the treatment is very good response. Second one is also a little bit okay. Third one not that good. Then fourth and fifth, there's no any kind of result. So for them, this is a big question, So from our point of view, the as a practitioner, maybe the quality of is not that important, not that like fulfilled, and also we are not seeing the individual as a separate entity. So that's why in Tibetan medicine we see every individual as different, based on the different, the Nyepa, Slung, Tibetan, Bagan. So life is very complex.
Yeah. So good answer. I also now I remember different patients. It's exactly like you tell. Yeah. So the same illnesses on the same level, but one kind we can help, another kind we cannot help. Yeah. We can have another reason. I think it's connected with the mental state with the patient. Isn't it?
Yeah, definitely.
Okay, doctor, we have a short interview now, but I'm so glad I hear your answer. Yeah. Thank you very much, and we hope we come again. You come again in Russia.
Thank you so much for having me here.
Спасибо.